In other words, the rich are educated and they don't have to smoke. They have other coping mechanisms, right? They have health insurance. So, tobacco, if you think about it, the single most important predictor in tobacco is socioeconomic status. 95% of the incarcerated individuals smoke. 95. 70 to 80% of the homeless smoke. I remember being in a group of talking about the homeless, and several of the homeless men that were there and a homeless woman said, listen, I smoke because I'm bored. And I said, because there's nothing to do. We have no employment. We're alone. We're sitting on a bench. What kind of companionship do I have? What kind of support system do I have? I'm homeless. You know, when Reverend Waters was talking about a sense of community and the support that you feel at a church, think about the homeless, the incarcerated, who have no support, the unemployed. Look at that, unemployed right now. We are in deep trouble in unemployment, and 42% of those adults are the ones that are smoking, right? So you talk about being an issue for the poor. The face of the smoker is a poor smoker, whether black or white or Latino. The lower the socioeconomic status, the lower the education. Here we have low income, higher smoking. Less education, more smoking. Less than a high school diploma are the higher smokers. So who are we? Who are we talking about when we talk about tobacco control? We have to, and how many of us? I want us to raise our hands and be honest. How many of us consider ourselves poor? Really poor? Are we under the federal level of being considered poor? Huh?
Whether we consider ourselves, and they're asking another way, just say, how do we realize we're poor?
How many of you realize we're poor?
We're in denial.
There are several, but the point is, for me, is I remember living in Kentucky, and there were several of my colleagues that would go out there to Appalachia. And I said to them, you can see being white does not make you culturally competent. Appalachia was a different culture. The culture of poverty is a different culture. Once you hit the middle class and you become educated, and yesterday I was told by my group, you don't know the community. Don't pretend you know the community. You're white looking, you have so much education, you dress a certain way, you present yourself a certain way, you don't know what it's like to be poor. Guilty as charged. So the point is, we are here to do outreach to those smokers. With what kind of attitude are we going to be going? If it isn't with a sense of honor and dignity, my God, they're a bunch of survivors. They're surviving. My God, would I be able to survive homelessness? Would I be able to survive, having gone to prison and back? Would I have been able to survive without an education? We have to start putting ourselves into that context, into that social justice frame of mind, and say, what can we learn from that smoker? What can we learn? Because it's the poor who are suffering. Substance abusers higher smoking rates. Okay? So, and the Asians are considered the model minority. The model minority. They are wealthy. They are educated. Guess what? It depends on the group where they're coming from. Their smoking rates vary. There's not one but the heaviest smokers are who? The people with serious mental illness. How many of us have suffered from depression? I have. I know what it's like to be depressed. How many of us know people that are depressed? Right? I mean, depression is a serious illness.
Yes, it is.
Yes, it is. And guess what cigarettes do? They help you cope. They're a high. They're self-medication. 75% of smokers have a past of current mental illness or addiction. 75%. So we need to look at who the smoker is and to see whether we really are doing the outreach that's necessary, whether I'm taking off my jacket and my jewelry and really walk in somebody's shoes. Okay? So this is what we are talking about. And guess what? The poor and those with mental illness die 25 years younger. So what does that mean? Let the ugly people die, I say sometimes. Because that's the policy that we have here. It's the poor, it's the mentally ill, the substance abuser. So it's a social justice issue. How would you say, oh, all of the poor, get back there, pop, 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 pop. We kill you right off. What's that? So, it really, another community that I don't see represented sometimes is a community that is very much affected by the tobacco industry, and that is the lesbian, gay, transgender, bisexual community. It's another white elephant that we don't talk about. Oh my God, in Latino communities, being gay, you might as well, think that you can't talk to your parents, you will never be accepted by your family, you're breaking the rules, the Catholic Church will get you out, you're terrible. And I understand that in the African American community, it's still a hidden issue, and that's why we have what? Problems with? Down low and HIV and AIDS. Serious HIV and AIDS in women, African American women and Latino women. Why? Because our men are having sex with men. Whether we know it or not. So how is it that we're here? We need to be thinking about that. Already they have double or triple the rates of smoking than most of us. So that's a community that is being left behind. That's a social justice issue. Just because of their sexual orientation, they're being left behind. Okay? So that's it, see? Both females and males. And youth now. So, and higher dropout rates. What is the dropout rate here in Arkansas, in African American communities? Anybody? Nobody knows what the dropout rate is out of high school? Excuse me?
No more than 27%, I would say, but I don't know what it is.
I think it's comparable to what you have.
All right. Comparable to what I have right here on the screen, 40 to 50%. We're in trouble. 30%, but think about what does that mean? 1 out of every 3 African Americans. That's what it means. 1 of every 2 Hispanics? What does that mean? It means that we are sliding in the slippery slope, right? And who did I just show you that less than a GED, higher smoking rates? So we have to be planning, oh my God, what have we here? It's a perfect storm. Low education, low literacy, low economics, right? So we need to be thinking about that. We need to be thinking, and you know, we have made great gains, and here in Arkansas, you have made great gains on the clean indoor air issue. But guess what? That doesn't mean that everybody has benefited from those gains. And guess who benefits least? Who benefits least? In California, that's considered like, wow, the Californians are really, they were the beginners in tobacco control. And yet, okay, African Americans, Asians, and Latinos are more exposed to tobacco in the workplace. Right here, when you think about that, you say, that's what's happening. Look at that. Look at the occupation by immigrant status. We are in production and also in services, and very little in the professions. Okay, construction. All of those are not covered by clean indoor air. The LGBT bars. How many of you have gone to bars here? How many of you go to clubs and bars? Who works there? Who is the bartender at the bar that you go to? It's a black male, okay? And they're exposed to tobacco because they work there, okay? Isn't that discriminatory that he should suffer that? Or that all musicians that go and perform here at any venue in order to earn a living, they have to be exposed to tobacco? Why? That's unfair. Why? Because we haven't mobilized those communities. And the same thing happens, you know, bartenders when they're women or Asians in California, okay? It doesn't matter. They are still exposed. People in maintenance, in food preparation, in production, personal care. You know, I discovered that here in Arkansas, who do you think are the people that are taking care of the elderly in these, in the nursing homes? Huh? Who?
The Black Americans, most of mainly the Black Americans.
That's right. Huh? African American women, poor women, because that job to be an orderly at a hospital or be a maintenance person in a nursing home is pretty low pay, right? And yet, are they doing one of the most honorable services that we have, which is taking care of our elderly? So, we are not seeing this as a, you know, as a issue. I know you don't supposedly have casinos here, but I bet you that at the racing, at the dogs, yeah, you have 2 casinos? I bet you they're not covered by clean indoor air. That's correct. So the poor are there, and unfortunately still Arkansas is behind on that. You can see, okay? Because you don't have that law. And see the percentage of the population, again, Arkansas is not completely up there nationally. So, we have to look at, we've already talked about where Latinos work in here. And I was sharing with my colleagues here that that Walmart, my sister lives in Mexico. She lives in Guadalajara because of the war in El Salvador. We had to migrate to Mexico in order to be alive. And now she's being invited. Her company in Guadalajara is going to have a contract with Walmart here. Okay? Just to give you an example of how there's an interconnectedness between Arkansas and Mexico. Okay? The towels are going to be made there in Mexico. See what I mean? We don't have all of the East Coast that used to do all of that, it's gone. Those jobs are gone. So, the point is, we're not protecting enough. Everybody needs to be protected. We're leaving people behind. There's unforeseen, unintended consequences. There are unintended consequences. Everybody celebrated today the smoke-free cars law, right? We said, wow, what is it, Proposition 11, isn't it? 811, okay? It gives me the creeps. Why? Because I come from the East Coast, where racial profiling is racial profiling. Where if there's an excuse to stop somebody for driving as black, he or she will be stopped. And right now, in Arkansas, if you have a Latino driving, you will see that who is stopped on the road. It used to be blacks, now it's Latinos. But blacks will be stopped. So we have to always think about the law of unintended consequences. Because if we don't educate the community sincerely and truly about this law, they're going to be caught doing it, and what? They can be really suffering those consequences. So for me, you know, we have to be, when I say, if you're not there, you're not there. When policies are being discussed, if we are not at the table to bring out those issues, nobody's going to think about those issues. And I don't know what the story is here in Arkansas for African American communities. I know what the story is for Latinos. They're scared to death to drive. I was next door in Oklahoma, okay? I went there, and the cops are right in the middle of the community, waiting every single day to stop Latinos on the way to work. Even the guy that came to pick me up at the airport, that I work at the community health center there, he was stopped. I was waiting, worried, why isn't he here? He had been stopped. You see what I mean? It's right up there, so what's the difference? So we have to look at that. That the poor, there are some unintended consequences. And I'm so very glad today that Dr. Bloom and Reverend Walters talked about what it takes to quit smoking, and the fact that community considerations are so important, the sense of support. Think about all of those men, primarily men, Latino men that come here to work. They have no support system. They can call the quit line, but if you are not part of a church, of a group, of a community health center, a support system, it becomes very difficult to quit. So we have to understand that, you know, that giving a patch is not enough. So it's important to think about how rental properties here. I'm delighted that you're all going to start working on smoke-free churches with policies. Hooray! And now I hope that we can have also in Latino churches the same thing, you know? Because all sacred ground needs to be smoke-free. And actually, when you think about it, the way Reverend Walters was talking about it made me think, you know, we say only our churches, everybody's churches. And every place should be hallowed ground, because every place is hallowed ground. So we need to be thinking big, you know. What about apartment buildings? Most poor people are renters. What about public housing? Public housing, who cares? Listen, the government, just by the county commissioner or the mayor, whenever there's any state money or federal money, with a little blip, it can say they're smoke-free. But we have to be careful, because we don't want to stigmatize the smoker to the point that they become, you know, homeless because they can't deal with that. So we have to be thoughtful on how we go about it. So if there's public housing, you can have 6 buildings are smoke-free and 2 or 3 buildings are for the smokers. And this way you're protecting the children from asthma attacks. You know, asthma attacks, you go like this, asthma is one of the biggest issues that we have, both in the Black community and Latino community, and it cost us a bundle. Not only the anguish to have a child that can't breathe, and I have had one, that, you know, it's a devastating moment, right? To see a child that can't breathe. So we have to be working on these issues and be concerned about discrimination. That's why I mean that this is a social justice issue. And the whole notion, if we are temples of God, our homes are also temples of God. You know, I think we can start there. A pledge for people to say that they're not going to smoke. Because the tobacco industry doesn't stop. The tobacco industry is coming up with new products. The FDA regulation is uncertain. And I really, when I look at this, I just want to say that the National African American Tobacco Control Network has led the effort to try to assure that menthol would be banned. We have been working on it with the Hispanic caucuses. But guess what? Between the Black caucus, the Asian caucus, and the Latino caucus, all of them taking money from the tobacco industry, guess what? I've been calling the Hispanic caucus and I do not get a single call back. So all of you think about how can you engage in this, because if we eliminate and ban menthol, guess what? 80% of African American smokers are going to find it difficult to continue smoking garbage, not covered with menthol. So this is a time for you to mobilize politically and sign on to letters. And Nathan is an absolute advocate on this. Okay? But guess what? Here's what the menthol data shows, and Dr. Bloom gave you that sense, but 37% of Latina women smokers smoke menthol. Okay? So we need to look at that. How many of you have seen the Switcher Sweets? Huh? Those are the new Lucy cigarettes, my dears. They cost $1.25, right? And that's what our youth are buying. And so these emerging products are a problem for all of us. And the marketing continues. Look at this if it isn't targeting African Americans. Of course. This is what's happening now. So, little cigars and cigarillos is where things are growing. Why? Because people don't have the $5.49 to pay for the pack of Marlboros. Right? They're going to buy one for $1.20 or two for $1.50, right? Cigarillos. And also, what you can do, you're going to find them blunts. The paper, you have it, and then you can simply, and they smell incredibly. The peach, strawberry. This is what's happening. You seem puzzled. Have you seen those blunt wrappers? Yeah. I mean, so they're after our kids, and with these new products. I mean, and you see how much they're going up? We say, oh, smoking is going down. And I say to them, well, but in our communities, cigarillos are going up. So what does that mean? We're just switching, right? The same thing for little cigars. So the issue is, Latino kids, now that you have 18% of those kids are Latino in the schools, guess what? They have the highest cigar smoking. What does that mean? That they're using those blunts, that they're using those cigarillos. They're not smoking a pack of cigarettes, they're using these. And look, African Americans, 6.9%. Whites, 4.4%. Going up, going up. So it's an issue. So I think all of you already know that African Americans, and we didn't talk about it today, but see how African Americans have a higher smoking rate than whites? Okay? So it's there, and look at the data in terms of right here. This is Arkansas data. So you need to target 18 to 24-year-olds, right? And less than high school degree. And high school degree. Those are the people you need to target. The poor, less educated. So this is about, we need to think about this as a social justice issue. Why should the poor bear the burden for all of us? Why? That doesn't make sense. Right? So there has to be equitable distribution. Are you working with homeless shelters? How many of you are working with homeless shelters? Okay, not many. They can be smoke-free. They can be centers for cessation, a natural support system, an alternative to boredom. So if we are not funding those programs in the churches, we are not really being equitable. So for me, it's about putting your money where your mouth is. Okay? I just want to say that in these hard times, the ones that are not going to be thought of are the poor. Why? And the people of color. Because we can be easily dismissed. If all of you are not engaged in policy, we're going to be easily dismissed. We don't exist for the legislators. How many of you have visited the state legislators? Please raise your hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Not enough. If we don't keep those legislators accountable and against the wall, guess what? They won't see us. They don't want to see us. This is not about wanting to be seen. If we are not there, laws are going to pass that are against our interest and the interest of the poor. Right? So I think it's important that you realize that. And that, the media messages are great, but they have to be targeted and they have to go to where people are that need it the most. And so it's important for you and to think about the Empower model. This is what the CDC has been pushing everywhere, and it's to monitor tobacco use. What do we need to monitor in African American communities? The sale of new products, little cigars, cigarillos, blunts, right? Lucy's, they're still being sold. We need to protect the people from secondhand smoke. What are the people we need to protect? The bartenders, the musicians, the waitresses. That in order to keep a job, you have to kill yourself in order to keep a job. To offer cessation and to really do it with a sense of honor and a sense of understanding and not judgmentally. It's a tough issue. It's a tough issue. And it's what's behind it. Why do people start smoking? What is the depression behind it? What is the loneliness that is being addressed? What is the lack of context? And also, listen, if I work at McDonald's and I have a coffee break, and at the coffee break everybody is a smoke break, what does that mean? If I don't join in, what? I'm isolated at work. Because there's no other chance to talk with somebody at work. Maybe that's the only chance you have communication, so you pay the price. So we need to understand that smokers are in pods, that they're in groups, And then the warning about the tobacco we have got to educate the community about it and enforce the advertising and restrictions. How many of you have been walking around and it just inevitably, where do you think you see the new ads and all of the mental ads? You see it in black and brown communities. You do not see them in high upper class neighborhoods. You just don't see them. So are you monitoring this? Are you taking the kids for them to see how their neighborhood, listen, if you live in a neighborhood with a broken window, it's the broken window syndrome. If you feel like garbage, you're gonna act like garbage. It's hard not to. And if all the time, where do you think? There's the liquor store, there are more liquor stores, those don't never close. Huh? They don't. So we're living in environments that are more polluted. By the way, African Americans and Latinos live already in more contaminated environments, closer to garbage dumps, closer to toxic waste disposal sites, right? So we need to see this as a social justice issue. And if we raise taxes here in Arkansas, guess what? You've got to demand money for your programs. And you have to think that also Latinos and Native Americans and Asians and the poor whites and the LGBTs, they need to get a piece of the pie. We need to expand the pie, not fight over the crumbs. Expand the pie. So that's what I called empowered, empowering leaders in the community, disseminating the information, and being engaged. Those have been added by us. So it's important that we have what's called parity in tobacco control. Parity, which means equality, which means we cannot continue being second thoughts or second fiddles. We need to be seen as first fiddles, right? So it's about actually being part of the strategic planning of the community readiness and being sure that the communities, I was told here, oh, Latinos don't apply for money. They just don't apply for money. Oh, they're not interested. And I come back and say, are they ready? Were they educated? Did you reach out to them? It's not, come to my party. Okay? I always think about being invited to a banquet, okay? And they invite you to the banquet. You get there, everybody has these big plates and so on, and you have no silverware. You have no way of eating it. So think about, we're meeting here to build capacity to use the silverware. Huh? Different way of looking at it. So, are you empowered is the question. Are you really engaged in thinking, not just about you and your institutions, but about those who are not here? The homeless, the poor, the mentally ill, the substance abusers, those who don't have the education to have a seat at the table, those in rural communities that are not seen, that have no teeth because they have never had oral health in their lives, or really a true education to get them out of there. We have to be thinking in some ways the way that Reverend Walters talked to us about today. It's about God's children, all God's children. This is not about me. This is about those who have no voice. This is about being the voice of those who are not at the table. And that's what tobacco control is for me. Thank you very much. I'm ready to take any questions. No questions? Yes, please.
Can you give us, like, I guess maybe a few tips or pointers on how we can actually reach the Latino community?
All right. Excellent question. First of all, you need to hire a Latino to be your partner. Why? Because just as if you had a white person coming in an all-black community, hello? Are you gonna get any traction over there? No. You're not gonna get any traction. So you need to partner. You need to hire Latinos. You need to hire Latinos that actually that know how to take the jacket off and the clasp off. Because you need to be able to reach that community. So that's one thing. So hire Latinos. All right? Secondly, wherever you are, think about who is not at the table. Sit there and say, here I am with the governor, and here I am in this commission, and here I am being called by the Office of Minority Health, and here I am being called by this and that, and the American Cancer Society, and all of these muckety-mucks. And you look around, and please, you know what it feels like to be a token black. You've lived being a token black, right? So think about that. It's not about putting one person out there to cover us all. We are diverse, right? Does one black person represent all blacks? No. Right? So think about it that way. Think about, listen, we have churches that meet in little basements, in houses. Have you seen them? Any of you? Can you raise your hand if you've ever seen a little sign now in Spanish next to a church? You have it in Indiana, but here I don't see 1, 2, 3, 4, 5. You go there. Where do you think Latinos meet? You know, you think that African Americans and Latinos are very different. Where do you think African Americans would be if you had the top rapper of the country coming to Pine Bluff? You think you're going to get a lot of African Americans to see the top rapper? You're going to. They're going to be there. So guess what? You become part of the sponsorship of that event. So it's a smoke-free event. You are then teaching the norm of a smoke-free idea, of a smoke-free community, right? You have to be in the radio. You have to pay for radio ads. You have to be in the newspapers and write articles for there are 4 Latino radio stations. And guess what? They listen to rancheras and music from their countries. Listen. If I go into an African American car, I know that it's not going to be a Latino beat that I'm going to go listen to. We have very separate music that we love, right? Very rarely are we interchanging musics. So you go to where the music is. To the clubs. How do you negotiate with a club to become smoke-free? We've done it in Indiana. So you need to be thinking about not calling people, come and see me. Oh, we sent an invitation. Listen, in an environment in which being scared is the daily thing, in every family, even if they've been here 5 generations, there's intermarriage with an immigrant. You fall in love. And that immigrant may be an undocumented immigrant. So in every family, there's fear for somebody. It was like, think about it. Think about it, what it was like to be black. And we are the new blacks. The moment you put that, if you put that hat on, you're going to say, I need to be thinking differently to outreach to my Latino brothers and sisters. Because that's what we are. We are in the same schools, in the poorer schools. We are in the poorer schools. We are going to die together. We are the new people that are being put in jails. Friends, okay? California used to be mostly blacks in the jails. Now it's Latinos and blacks.
That's right.
We're fitting them in.
That's right.
So think about that when you're thinking about a program for Latinos. Or we live together, become stronger together, or we die together. This is about our own interest. And today I am honored to come to you and say to you, take us into your bosom. Your gains in the civil rights movement is what has become for us our mantra. You are our examples. You are the ones that have opened the doors. And I want to say thank you. And I honor you. But the quality of a human being is whether they keep that door open, whether they open their hearts to those who you don't know. It's like the Bible says, it is whether you treat the stranger as yourself. That is what this is about. This is about whether now that we're feeling the pinch, the economic pinch that has nothing to do with us, it has to do with the rich becoming richer, whether we have the Christianity in our hearts to stand up and say, we are one people, one nation, and we have one life together. Thank you very much.
Thank you, Dr. Notinius. We'd like to present you also with the Arkansas Travelers Award, so that you'll be a goodwill ambassador for the great state of Arkansas.
Thank you so much. Thank you very much.
I have one other presentation I would like to make. Each year we conduct the Minority Initiative Awards, and we always award a sub-grantee of the year. We have 18 currently funded by our program, and this organization is chosen by the staff. It's someone who exhibits high integrity, who always is there and provides the information that we need. And so this year, the staff has chosen the Coalition for Tobacco-Free Arkansas as 2011 Sub-Grantee of the Year. So thank you so much for attending the 8th Annual Clearing the Air and Communities of Color Conference. I'd also like the Planning Committee to stand, and I'd like to send a very special thank you to the Planning Committee, to UAPB TV, to UAPB Learning Resource Center, Mr. Reedus, the individuals on program, and all of you here in attendance. We welcome you back next year, same time next year, except we'll be on the Wednesday and Thursday next year, same time next year, right here at the Palm Beach Convention Center.